Hello, Dr. Mian. It's so nice to see you again.
Nice to see you too.
Oh, thank you. I'm very, very curious about something. Semaglutide is this big trend in the industry. I'd love to hear your opinion of whether you plan on bringing that into your practice and what you've seen, the good and the bad and the ugly about semaglutide.
That's a great question. So I can start off. That medication I think is fantastic, particularly for diabetics, because it does regulate blood sugar. And for those folks, can really help them lose weight when there's a lot of insulin resistance. However, I also see it as a big negative in people who are non-diabetics who are trying to lose weight. So number one, I see that people can sometimes have other side effects. So I've had actually reps and patients come in who have tried it and they're like, I'm dizzy, I'm lightheaded, I feel really fatigued. They're coming to me for a neurological issue to see why are they dizzy, lightheaded, and fatigued. And so we're running tests. And then ultimately, one patient says, well, I actually just cut back the dosage or decreased it by half and I felt much better. In that case, the patient's blood sugar was fine, but that was just a side effect of the medication. In another case, I actually had a rep come in and he was telling me this is a younger guy and he's more fit and he was trying to lose a little bit of fat around his belly, which a lot of people try to do in general. And he was like, you know what? I was at the gym and I was lifting weights and I started not feeling so good. I was getting lightheaded. I felt like I was going to pass out. I had to walk out of the room and walk out of the gym, take my hat off and sit down for a little bit to let it pass and eat a little something so I felt better. In other cases, I've been seeing this in the last few weeks where folks who are on semaglutide and anti-seizure medications, and they had only been on the semaglutide just for a few weeks, they ended up having a seizure after being so well controlled for a long period of time. And so think to yourself, well, there's no listed interaction with any of this. And even the doctors in the hospital, yeah, there's no interaction, but you have to think about what is the mechanism of this medication, right? This medication is slowing things down in your gastric tract. So what else is it going to slow down? It's probably going to slow down the absorption of your medication getting into your system. So if you're using other medications, you can think about what would be happening with all of that. So it's not just because it slows down food being processed, it could also potentially affect other medications. And this is just anecdotal and seeing like a couple of different people in this particular scenario. So I imagine as the years go on and more people are using this, we'll probably see more of this. The other thing with this medication is that once you stop using this, you will end up getting your weight back. If you're somebody who's particularly young, thinking that, hey, I'm just going to do this just for a couple of weeks or a few months and then I'm going to be good. If you do not implement any lifestyle changes, you don't take care of yourself, you don't start eating better, you don't start exercising, you don't take care of some of the toxic habits you may not have, your sleep habits and so forth, and go on, that's a likely scenario to happen. And I've seen that with other patients who have actually been on these medications just because they were really overweight and they felt good about losing weight and it came right back within a short period of time. Kind of like anything else that's done in medicine, whether you're getting plastic surgery, you're getting different types of cosmetic treatments or regenerative treatments or medical treatments, whatever it is, at the end of the day, whatever is being implemented, you really got to maintain yourself thereafter. It's not just a one-time thing. People really need to be aware of that. And then obviously as insurance is changed too as well, insurances may not cover some of these too. And it's hard to get the coverage in general for most people unless they're really obese, have certain other medical conditions, or now it's being indicated for heart-related issues too. And that's where I've seen some cardiologists put people on. Like I said, I think ideally for diabetics, I think it's a very good drug to be on because it seems to control things fairly well. It helps them lose weight, which helps with their diabetes overall. But I think in the average person, you really got to think twice about what you're doing. Or if it is being implemented, it has to be carefully controlled where you're carefully controlling the medication you take, but you're also implementing the lifestyle changes that ultimately need to be done so that you can do the best you can to sustain as much as you possibly can once that medication does come.
It occurred to me while I was listening to you that there's value if anyone, especially in the Denville area, if anyone is interested in getting into semaglutide, I would go see you for an assessment before I go to the physician that has the vested interest in getting me to take it.
Yeah, and so just also a little sidebar, the rep for semaglutide came to me 12 years ago when that medication just had come out. Nobody knew what this was about or what any of this was about. And so the rep at the time was telling me, hey, this is a diabetic medication. Like, okay. I didn't really understand much about it. But really what we want to do is push it towards weight loss because we see people losing weight. So we're talking about 12 years ago. This is way before any of these trends came out. And I decided I didn't know much about it really at the time. And I didn't think that was necessarily the best option. I'm always going to be proactive in terms of doing things where you're really trying to take care of yourself. There are other things you can do that would cause less harm, and with certain treatments, even that we do, I should say the treatments we do don't cause any harm. And with the laser that we do, it doesn't cause harm. I definitely talk to people about these things all the time, so it'd be great if you are thinking about that, then maybe that's a conversation that we could have, or if not with me, at least with your doctor at some point to see if this is truly the best option.
Okay. And I heard you mention a laser, so I'm assuming you're talking about the Emerald that you have in your office. Do you have other things that work on reducing areas of fatty tissue? And what's your opinion on that medically?
Well, medically, I think the Emerald laser is great. We looked at a lot of different treatments for people over the last few years, and things such as the Morpheus, which is more invasive, but is incredibly painful. There's the Sonobello, and these are all more invasive, more painful. So one treatment that we found that actually was not painful whatsoever. You literally can do it on your lunchtime. There's no pain, there's no dying down. It basically creates holes within the fat cells so that they shrink down. They're not getting rid of the fat cells, because even if you take them out with a liposuction, those cells can grow back. And I've heard even that from plastic surgeons as well. This is a tool that we use to help people to not only feel better, but to look better, but ultimately metabolically, and their metabolic health, that can also help as they reduce some of the size of these fat cells. We'll often combine it sometimes with certain dietary changes and even supplements that actually help regulate your blood sugars, your appetite or whatnot with less of an issue. And you do feel full longer. For instance, if your blood sugar is well regulated, you should be able to go a long time without even eating. Some people have certain supplements on, they just don't feel hungry. And that's because their blood sugars are not going like a roller coaster. Think about the person who is ravenously hungry by 12 o'clock or 11 o'clock. I got to eat something, otherwise I feel really shaky and I'm going to fall down. I'm just that hungry or whatnot. That's really when you have some insulin issues that are going on, because now you're getting reactive hypoglycemia. And so if you can smooth those things out, people ultimately will end up eating less, one thing, number one, but then also decreasing insulin resistance will help somebody lose the weight. And so that's a little bit more of a natural way of doing things, as opposed to taking medication, which basically is shutting down everything or really decreasing trends of things going through your GI system.
I really appreciate that personally, because it always worries me when we're messing with medications in our bodies. I know a lot of people who are doing it. So thank you very much. Appreciate it. Dr. Mian, I was with relatives up in northern Minnesota this weekend and through the week. We were moving very big pieces of furniture, and these are very big, strong men who were fine lifting the furniture. But one of them said something that was interesting. He said, it doesn't bother me to lift things and do things. It sometimes I get excruciating pain. I throw my back out for no reason. I'll get shoulder pain. I'll throw my back out. Don't know what I did. It could be I'm leaning on the counter the wrong way, whatever it is. Can you explain what that is and the best way to avoid that or care for it and what's going on?
I see this very often, even then it's happened to me. And I'll tell you a little bit later about what I did to help with that ultimately at the end of the day to help fix that problem. I analogize this to the game Jenga. That's a game where you have all these blocks that are put together. The game basically is taking each piece out without making things fall. Ultimately, it gets down to the point you just take one block out at the end and everything collapses, and that's the person that loses, essentially. You can think about this with the body too as well. Things will break down, things will degenerate. Disc will start herniating because there are ligament changes that kind of allow the material to come through. Ligaments also hold the spine together, in this case, like with the back specifically for this. So what happens is that it's quite possible when somebody's lifting heavy things or using back braces to do the work, they're not really having too much because they're using their accessory muscles to help stabilize their core. But as soon as they take that back brace off and then they just go in to bend over to tie their shoelace, they throw their back out and they're on the floor basically at that point. That's that Jenga analogy where you pulled out that last block. And that's because that's that instability between the ligaments, tendons, and joints within the spine. And so when things move, the nerves can also get very irritated as well. So common things to do that are non-invasive, obviously, is you definitely want to work on your metabolic health. For some people, it's going to be big changes in their diet. It's not just a matter of just eating vegetables or whatnot, but it's also a matter of the exercise that they get. So it's not just heavy lifting, but it may be they're on the treadmill moving very fast for 20 seconds and then they're stopping. So they're doing interval training or they're doing other exercises to try to help reduce belly fat. In terms of what I did to help me overcome this, and this is one of the things that I do in my office, I actually ended up having PRP in my back. probably still need to go for one other. And actually, interesting enough, there's an individual in Minnesota who I go to who's very good at this. I trust for myself that I go to, but just having done 2 treatments for that helped me from throw my back out constantly, because I was doing the same thing where I just slightly hunched over. I'm not like a huge person by any stretch of the imagination, but I just did something like that, and that was causing problems. And maybe the injuries may have occurred during weightlifting or doing other things. And so the PRP was actually able to help stabilize my spine because it's addressing ligaments, joints, tendons, things that hold your pelvis and your spine together. So we found that to be very beneficial and very helpful. Outside of PRP, as I mentioned before, definitely reducing the circumference of your waist and putting less of a load on your core is helpful. But then, as I mentioned in the beginning, it's also strengthening the accessory muscles. So we're talking about your hips, your glutes, your thighs, all that, because it acts as a girdle for your spine. So when all of that's firing, so to speak, or activated, there's less load on your spine. But when all those things are working synergistically very well, where is all the tension going? It's all going back into your spine. Then it doesn't take much to set that off then at that point. So definitely the dietary changes, the exercise, very generically for sure. There are different ways of trying to help that, even if things like intermittent fasting or cutting out things like sugar, gluten, bread, pasta, rice. All those things can certainly help and help people drop weight a little bit quicker along with some exercise. For those people that are still struggling, then perhaps the PRP route might be the best option. Steroids are a very common treatment for people with spine pain or back pain, but it doesn't address any of the instability. It just maybe helps the nerve temporarily at best. A lot of people get epidurals and they're very hit and miss. And then if that doesn't work, what happens is that the surgeon ends up trying to remove bone or tries to stabilize things actually by using, for lack of a better word, metals, rods, and things like that to stabilize your spine, which in and of itself causes other issues. Key, obviously, with anybody is just preventing things and preventing yourself from getting to that point where you are throwing your back out constantly. But if you do have that, then we do know that there are other options, at least that can help and get you out of that pain.
What's your opinion, too, about addressing that particular type of condition with a chiropractor?
I think with the chiropractor, it's something where, and I tried carefully saying, is that you can get some temporary relief with the chiropractor, maybe potentially. One of the things that I do find a bit problematic is that when folks are going to chiropractors, they're told they have to come every week or every other week, and they lifelong have to do this constantly. And so they're constantly trying to put things back into place. It keeps popping out. And it goes back to the original point that I had, is that there's instability in those joints and ligaments to begin with. So to address those things, when things are really starting to smolder, that's the time to do it. But the chiropractor obviously is the non-invasive way of doing it. And as long as you're getting relief from that, or you're willing to go frequently all the time and do that investment in time, then that certainly is a simple way of trying to address this, at least for the time being.
All right, Dr. Mian, it was great seeing you. Thanks so much.
Yeah, I appreciate it. Thanks so much.
Take care. Bye.
All right, bye-bye.